The worry I had was that I would do something wrong.
And so I was getting this little baby, chunky little boy, with all these tubes hanging out of him, and I was really scared.
What I found out was that if you very patiently work with yourself and work with the nurses to learn what the proper techniques are, that you can do it.
He has a wonderful time, he has a wonderful life, and we just treat him like any other kid.
Hi, I'm Tim Weiner. You've learned that your child needs the placement of a central venous catheter. The catheter is necessary to improve your child's health. We understand that deciding whether to have a central line placed and choosing the type of line are hard decisions. Your healthcare provider will help you make informed decisions regarding placement of a central venous line for your child. Central lines involve learning new skills and a new way to care for your child. It may be comforting to know that many parents feel the same concerns initially, but are relieved that your child is given the chance to become healthier or feel better.
The biggest thing that you worry about with a central line, whether it's a Broviac or a Portacath, is the fact that you could get an infection. The child could get an infection that's very serious in the blood, because you are directly accessing the bloodstream when you're using a central line venous catheter. And the worry I had was that I would do something wrong. And what I found out was that if you very patiently work with yourself and work with the nurses to learn what the proper techniques are, that you can do it. You just have to realize it's going to take time. You can't do it overnight. You can't become an IV nurse overnight, is what I said. And there's a lot to learn, but it's doable.
If I were to think that I'm going into his bloodstream twice a day, I'd go mad. So I don't think about it very much. I think about the process of keeping everything clean and sterile, but I try not to obsess on the fact that I'm really accessing his bloodstream when I hook him up and then when I disconnect him. That can be a scary thing, but if you practice your technique, you'll be okay.
This video has been produced especially for you to help you know what to expect and to learn how to care for the catheter. If you have questions concerning any aspect of this video, please contact your healthcare provider. Now, let's begin by reviewing the central line procedure. A central venous catheter is a thin tube that is placed under the skin into a vein that empties into the heart. The catheter is often called a central line because its tip is positioned centrally, that is, close to the heart. Some people simply call it a fancy IV. Children need catheters placed for a variety of reasons: to receive medications, to receive intravenous or IV nutrition, to receive blood products, or so that blood samples may be taken. It's important that the catheter tip is positioned in an area that has fast blood flow. This ensures that medications and solutions are properly diluted. After any type of catheter is placed, an X-ray is taken to make sure that the tip is positioned properly. Several types of central venous catheters are manufactured. While the catheters may vary in appearance, they all serve the same purpose. Some types of central venous catheters exit outside the chest or thigh and are called external catheters. Broviacs and Hickmans are two types of external catheters. Other types of central venous catheters lie completely under the skin and may simply be called ports. Metaports, Portacaths, and Fusic ports are examples of port catheters.
Hi, I'm Dan von Allman. An external catheter is tunneled under the skin and has 1, 2, or 3 tubes, each with its own cap. These cap tubes remain outside the chest or thigh. An advantage of this type of catheter is that your child will not need as many needle sticks in order to receive medications or to take blood tests. To properly care for an external catheter, you must learn how to do dressing changes, line flushes, and cap changes. A later section in this video will help teach you how to care for an external catheter.
With it being an external catheter, we were worried that he was going to pull on it. He was a very small child and you worry that they're going to pull on it, but then they can show you techniques, and we learned techniques to be able to put the catheter into safe places to where he really didn't mess with it and it just became a part of him.
When they come to draw blood, They don't have to poke me in the arm or in the hand or whatever. They just draw it straight out of the Broviac. Other than physical activity and contact sports, I can do pretty much anything a regular kid would do.
I don't worry about it breaking. I don't worry about the routine little boy activities. He's a wild child. He has a wonderful time, he has a wonderful life, and we just treat him like any other kid.
Port catheters lie completely under the skin and are suitable for children who need long-term therapy that is not continuous. The port is a small titanium or plastic container or tank that is attached to the catheter tube. Although ports are not visible, the skin above the port may be raised slightly, appearing as a small round lump. An advantage of the port is that site care is only required when your child is receiving treatment. When the catheter is not being used, it only requires monthly flushes with a medication called heparin to keep it from clotting. The main disadvantage of ports is that a needle stick is required every time the port is used for treatment. The good news is that creams and sprays that numb the skin are available so that your child won't feel the needle sticks as much. Emla and Elamax are examples of numbing creams. To properly care for a port, you must learn how to do dressing changes, line flushes, and cap changes. A later section of this video will teach you how to care for a port catheter.
Part of the decision-making process was whether or not she'd be stuck every week with a needle and how she would react to that. And we were very concerned because she didn't respond to the tape well in the hospital and is not much into physical pain and can be very sensitive, we think, at times. And so that was my biggest hesitation for going for the portacath, but it is very short and quick, and we have a lidocaine cream that we put on before we go to the hospital, and it does help to numb. She fears it more than it hurts, is my impression, because the workup to it, and they clean it, and there's a whole workup, and she'll get kind of excited and kind of teary, but then once it's done, she's, okay, great. Then we just move on from there. It's not as traumatic as I thought it would be.
If you have Elamax on, you only feel pressure. After like 3 or 4 times, I stopped being scared of it.
Yeah, you get used to it. So it don't really hurt as bad. Like, the first time you get it, you're real scared, but it don't really hurt that bad.
When you get it in, it hurts a little bit, but in a few days, it will not hurt anymore. It'll just be like the other parts of your skin, it won't hurt anymore. But when you put the needle in, it hurts one little bit, but other than that, you can't, it doesn't really hurt. It's just there, and it's just a thing that helps you.
Before I get my port access, I have cream to put on that numbs it, so I don't feel anything. And I'll just close my eyes and just think about like anything different that makes me happy or whatever. And I just don't think about getting access. And when you're not thinking about it, it doesn't bother me as much, and I can't even feel it at all anyways, so.
I guess it was a couple years ago, she started having problems with the PICC lines and things that they were using to get the IV meds into her system, and where they weren't lasting real long, and we were having to go back and forth to the hospital to have them redone. And after having one hospital stay where she probably had 7 regular IVs, you know, in about 2 days, we started talking about what the options were. And so getting the port we discussed that with the nurses and the doctors, and Kelsey was very much in favor of doing that. She had talked to some other kids that had ports or that have ports, and that, you know, they thought it was great and much easier than coming in and having to have the needle in your arm and have that, you know, get stuck for the IVs and stuff, the typical things that you have to go through.
The word PICC stands for peripherally inserted central catheter. This type of catheter is also an external catheter that is tunneled under the skin. A PICC can be inserted by a nurse or by a surgeon. These catheters are small and soft and can be placed at the bedside or in a procedure room. PICC line placement is well tolerated in many children. Peripherally inserted means that the catheter is placed in the arm near the inside of your child's elbow. Because of the PICC's placement, there may be less chance of complications that sometimes occur with other external catheters or with ports. However, some children do not have veins in their arms acceptable for PICC placement. Your healthcare provider will discuss the option for PICC line placement with you if your child is a good candidate for this type of catheter. A PICC line is still a central catheter because it enters a large vein called the superior vena cava. Because there is enough blood flow to dilute any drug, even irritating medications and solutions can be given by this route. A disadvantage of the PICC is the higher risk of the line getting pulled out by an active child. Caring for a PICC line involves learning how to change the dressing, flush the catheter, and change the cap. Management of your child's catheter will depend on which type of catheter is selected. Your healthcare provider will provide instructions on how to care for your child's catheter.
Hi, I'm Christy Geib, a pediatric surgeon or other surgical specialist who routinely operates on children will evaluate your child if he or she needs a central line catheter. Pediatric surgeons devote their practice to the surgical care of children. Your child's primary doctor will refer you to a specialist who will place the catheter at a children's hospital or at another hospital familiar with the routine surgical care of children. A children's hospital is planned around the special needs of children and their families. If your child needs an external catheter or a port placement, he or she will need to have an operation. Your child will be asleep during the procedure under general anesthesia. Your child needs to know that this is a special sleep that prevents them from waking up until the catheter is in place and it is time to go to the recovery or wake up room. We recommend that you try to explain as much of this as possible to your child before the procedure to try to reduce their fear and anxiety. If possible, contact or visit the hospital unit beforehand and find out what you will need to bring on the day of surgery. We recommend that you bring your child's favorite doll or toy so they have something familiar to comfort them when they wake up after their operation. Parents are allowed to be with their children as much as possible, and in some hospitals, one parent may be able to go to the operating room while their child is being placed under general anesthesia. After the operation, your child will be brought to the recovery room where one parent can see the child shortly after his or her arrival. When your child awakens, he or she will have a dressing or bandage over the catheter site and an IV in their arm or leg, which is used to give fluids and medicine during the operation. After recovery, children may be able to go home or may be admitted to the hospital. Your child will be on a floor that specializes in taking care of children. If your child needs to stay in the hospital overnight or longer, every effort will be made to make him or her as comfortable as possible. When overnight hospitalization is necessary, one parent is encouraged to stay with the child. If your child has a port, skip to the section of the video titled How to Care for an Implanted Catheter or Port.
Hi, I'm Amy Lamb. Before going home with your child, you'll learn to take care of his or her external catheter. Basic care will include 3 things. First, changing the dressing or bandage and cleaning the skin around the catheter. Second, flushing or rinsing out the catheter with saline and heparin to prevent blood clotting. And finally, changing the cap on the end of the catheter. First, let's talk about the dressing change. The catheter should always have a dressing covering it. This keeps the area around the catheter clean and protects it from being pulled or tugged on. Central line dressings should be changed at least 1 time per week with a sterile, occlusive dressing. This means that the dressing must stick tightly to the skin to keep out dirt and germs. Your child may require more frequent dressing changes depending on their activity.
The initial time at home by myself, I was a little nervous, but since then, with him having his dressing changed every other day, I had to get used to it a lot faster than changing it once a week.
When bathing, the central line dressing and catheter must be covered with a water-resistant material. The catheter should never be submerged underwater. If the dressing becomes wet, loose, or soiled, it should be changed immediately.
The other thing that I've learned through the years is the bathing situation. When he was little, of course, he was bathed in and out of the tub in a matter of minutes. He wasn't, because he was little, allowed to just flop around and be unsafe. As he got older, I let him bathe himself, and that's when we started getting line infections. And I wish I had made the connection between the baths and line infections sooner.
Supplies for the dressing change will be provided by your home health agency, hospital, or clinic. A nurse or social worker will help set this up for you. At UNC, these supplies include alcohol, chlorhexidine, and a cover dressing. Other institutions may use different supplies. Follow your nurse's instructions for your child's catheter.
Before you start any care for the catheter, you must wash your hands with soap and warm water. Take your time and be very thorough. You don't want to spread germs to the catheter. Once your hands are clean and dry, try not to touch anything other than your child's catheter and the supplies. When necessary, wash your hands again and start over. The steps for changing the dressing on an external catheter are as follows. Open your sterile dressing kit. Remove the mask from the kit and place it over your mouth and nose. Tie the mask behind your head. Then place a sterile mask over your child's mouth and nose. Remove the old bandage by gently peeling it off, starting at the corners. Look at the site where the catheter comes out of the skin. Is it red, swollen, or do you see pus or drainage? If you do, finish the dressing change and then call your doctor or home health nurse right away. These signs may be the beginnings of an infection, and your doctor may need to examine your child.
When I'm examining the site, one of the things I look for is increased redness. There's always just a little bit of redness around it just because there is something going into the skin there, but if there's any extra redness, any pus or any like scabs or anything like that, that would be something I'm looking for when I'm changing the dressing each time.
Once you learn what to look for, then you know when to call the pediatric surgeon or the pediatric staff at the hospital and let them know if there's anything you're concerned about, and they're right there for you. I mean, if there's any question, anything in your mind at all that you're worried about, they will see you right then and there. There's just never been a time where Miles wasn't seen when I just had even the slightest question. So I always felt like I had really good backup if there was anything that I was concerned about.
Remove the sterile gloves from the kit and open the package. Be careful to only touch the inside cuff of the first glove with your bare hand. Place the glove on your hand. Using the gloved hand, reach inside the cuff of the second glove and place it on your other hand. Now use your sterile gloves to remove the package of alcohol swabs. Use the 3 alcohol swabs to clean around the catheter. Start at the catheter's exit site and clean around the catheter in circles, always moving outward from the site. You want to clean all the skin that has been covered by the dressing. This is typically a 3-inch circle. Repeat the same cleaning with the second alcohol swab. The third alcohol swab may be used to clean the part of the catheter that will be under the dressing. Each time, start at the catheter's exit site and clean outward. Next, use the chlorhexidine swab if your child is over 2 months of age. Clean in circles with the swab, just as you did with the alcohol swabs. After this, let the skin dry for several minutes. Do not wave your hand over the area or blow on it. This can spread germs. Allow the area to dry by itself. After the skin is dry, place the new cover dressing over the catheter's exit site. Loop the catheter up and tape it securely to the dressing. And make sure the edges are sealed so the dressing will stay on tight. Finally, throw away your supplies as directed by your nurse.
Great job! Remember, some institutions may use different supplies such as iodine solution, betadine, or even different types of dressings. Follow your nurse's instructions for your child's catheter. Now let's move on to flushing the external catheter. Remember, the catheter is a hollow tube which lies inside a large vein. Blood flows around the catheter and can clot inside the catheter. Flushing will help prevent this from happening. A sterile saltwater solution called saline and a medication called heparin are the flushing solutions which prevent the formation of blood clots in the catheter. The amount of saline and heparin used depends on the size of your child's catheter. Your nurse will tell you the specific amounts to use for your child. At UNC, we flush catheters on Mondays, Wednesdays, and Fridays or any time after the catheters are used for medications or blood drawing. We also use a needleless system like most home health agencies. This means that you won't have to put a needle into the cap when flushing the catheter. More on that in a minute. Let's see how to prepare the saline and heparin syringes.
First, gather your supplies. 2 10cc syringes, one for saline and one for heparin. You will also need a needle for each syringe, a vial of sterile saline, and a vial of heparin. You also need alcohol wipes and sterile gauze. Your home health agency will provide these supplies. Some home health agencies use syringes already filled with saline and heparin. Clean your workspace with alcohol from a bottle. Next, wash your hands thoroughly with soap and warm water. Remember to be careful not to touch anything other than the supplies. Open the syringe packages. If the needles are not already attached to the syringes, do that now by twisting the needles onto the syringes and lay them on the clean workspace. Be careful not to touch the tip of the syringe or the base of the needle. Now flip off the saline vial lid and use an alcohol wipe to clean the rubber stopper. Next, remove the needle cap and pull the plunger on the syringe back. This pulls air into the syringe. Now push the needle through the rubber stopper. Push the plunger to force air into the vial of saline. This will help the saline flow out of the vial easier. Turn the vial upside down and let the saline flow into the syringe. When the syringe is full of saline, turn the vial right side up and take the needle out of the rubber stopper. If any air bubbles are in the syringe, carefully push the plunger forward to remove the air. Warning: air should never get into the catheter. Replace the needle cap very carefully. Now prepare the heparin syringe in the same way. The amount and type of heparin is different for each size catheter. Your nurse will tell you exactly how much and which type of heparin to use for your child's catheter.
Once the saline and heparin syringes are prepared, you are ready to flush the catheter. The steps for flushing the external catheter are as follows.
Before you begin, wash your hands thoroughly with soap and warm water. Remember to be careful not to touch anything other than the catheter and the supplies. Scrub the cap of the catheter with alcohol wipes for 5 to 10 seconds to remove germs. Once the cap is cleaned, continue to hold it upright. Do not lay it down directly on your child's skin, since there are germs on the skin. If necessary, you may lay the cap inside a piece of sterile gauze. Next, pick up the saline syringe. If you are using a needleless system, remove the needle and attach the syringe to the cap. Make sure the clamp is open on the catheter. Push the saline in with a slow, steady motion. The saline should flow into the catheter easily. If at any time flushing is difficult, do not use force. Stop what you are doing and call your doctor right away. If the catheter is clotted and you force the flush, you could create a hole in the catheter. Now take the saline syringe off and pick up the heparin syringe. Remove the needle from the heparin syringe and flush in the heparin, just as you did with the saline. Now close the clamp on the thickened part of the catheter between the marked arrows. After you have finished, form a small loop with the catheter and tape it securely to the dressing. Finally, throw away your supplies as directed by your nurse. Everything can be thrown in the trash except the needles. Your nurse will give you a special container for these.
If at any time the flushing doesn't feel easy, this may be a sign of a problem. Check the following. When you're flushing, make sure the clamp on the catheter is open. If it's clamped, you will not be able to flush the catheter. Lay the catheter out straight to prevent kinks or bends, which make flushing harder. The last part of caring for your child's external catheter is the changing of the cap. The cap should be changed every 3 to 4 days. It may be changed more frequently depending on your child's therapy. For example, the cap can be changed on Mondays and Thursdays or whenever you change the IV tubing. In addition, the cap can be changed at the same time you are flushing the catheter. The steps for changing the cap are as follows.
First, gather your supplies. You will need a sterile cap, a mask, and a sterile set of gloves. 2 10cc syringes. You will also need a needle for each syringe, a vial of sterile saline, and a vial of heparin. You will also need alcohol wipes and sterile gauze. Before you begin, wash your hands thoroughly with soap and warm water. Remember to be careful not to touch anything other than the catheter and the supplies. Open the new cap and be careful not to touch the inside tip of it. Scrub the new cap with an alcohol wipe to make sure it is clean. Then take the saline syringe and attach it to the new cap. Flush the cap with normal saline. Now close the clamp on the thickened part of the catheter between the marked arrows. Scrub the connection between the catheter and the cap with an alcohol wipe for 5 to 10 seconds to remove germs. Unscrew the old cap. Then take the new cap, screw it into the end of the catheter. Open the clamp on the catheter. Push the saline in with a slow, steady motion. It should feel very easy to flush. Now take that syringe off. Next, connect the new IV tubing to the cap. If you are not going to hook the catheter up to IV fluids or medication, attach a heparin syringe and flush it in, just as you did with the saline. You may leave the catheter unclamped except when changing the cap. This will minimize the wear and tear that occurs to the catheter over time. After you have finished, loop the catheter up and tape it securely to the dressing. Finally, throw away your supplies as directed by your nurse.
At discharge from the hospital, you should be given a to-go kit. Keep this kit with you at all times. It should include clamps, caps, gauze, and alcohol wipes for emergency situations. If the catheter breaks or gets a hole in it, clamp the catheter immediately on the side of the break closest to your child. You can either use the clamp on the catheter tubing itself or a set of smooth, toothless clamps. Next, take your child to your doctor or nurse immediately. If the cap falls off, immediately clamp the catheter close to your child and scrub the catheter opening with an alcohol wipe. Then replace the cap with a new sterile one. If your child has an external catheter, skip to the section of the video titled Complications.
Hi, I'm Rosetta Smoots. Before going home with your child, you'll learn to care for his or her implanted catheter or port. Most of the time, your child will not have the port access while at home. Access means that a needle is in the port so that IV medications can be given. If your child does need to have the IV medications at home, your home infusion company will provide the supplies and medications. A nurse or social worker will help set this up for you. In this segment, you'll learn how to maintain the needle and dressing and how to deaccess the port when IV medications are done. Deaccessing means flushing with saline and heparin and then removing the needle. First, let's discuss accessing the port. In most cases, only a doctor or nurse will access your child's port. However, in some cases, families are taught how to access the port. Remember that accessing means putting a needle through the skin down into the port so that medications can be given or so that blood can be drawn for tests. It's easier to access the port if your child is lying down on a bed or a couch. We also recommend using a numbing cream, which helps lessen the pain of the needle stick. This cream is normally applied 1 to 2 hours before accessing the port. Your nurse will tell you exactly how far in advance to apply the cream. You'll need the following supplies to access the port.
A 90-degree non-coring Huber needle. This is a special type of needle that will not damage the port. Do not use any other type of needle to access the port. Your nurse or doctor will decide the size and length of the Huber needle. 2 10 cc syringes, one for saline and one for heparin. You will also need a needle for each syringe. A vial of saline, which is salt water for flushing, and a vial of heparin, which prevents blood from clotting in the port. 2 alcohol wipes are required, one to clean the top of each vial. A needleless cap to put on the end of the port tubing. Finally, you need a sterile dressing change kit, which contains cleaning solutions, sterile gloves, a face mask, and a cover bandage.
The following steps outline how to access a port. 2 people are needed for this procedure.
Before you begin, take a minute to feel the port on your child. You should be able to put your fingers around it so that you feel the whole port. This will help you know where to put the needle. Clean your workspace with alcohol from a bottle. Next, you and your helper must wash your hands with soap and warm water. Take your time and be very thorough. You don't want to spread germs to the catheter. Once your hands are clean and dry, try not to touch anything other than your child's catheter and the supplies. When necessary, wash your hands again and start over. Open the dressing kit by peeling back the cover. What's inside the kit is sterile, but the outside of the kit is not. Remove the mask from the kit and place it over your mouth and nose. Open the sterile gloves package completely on the clean workspace next to your child. Use the inside surface of the sterile gloves package to lay your supplies on. This is called a sterile field, and everything you lay on the field must stay clean. Carefully open the Huber needle package and without touching the needle, drop it out onto the sterile field. Next, open the syringes, needles, and cap and drop them onto the sterile field. Remember not to touch these items. Place the vials of saline and heparin nearby, but not on the sterile field. Your helper will have to hold these for you when you prepare the syringes. This will be discussed in more detail in a minute. Now remove the sterile gloves from the open package. Be careful to only touch the inside cuff of the first glove with your bare hand. Place the glove on your hand. Now use the gloved hand to reach inside the cuff of the second glove and place it on your other hand. Once the gloves are on, be careful not to touch anything other than the supplies on your sterile field or in the sterile dressing kit. If you touch something outside of the sterile field or kit, dispose the contaminated gloves and open a new package of sterile gloves. Next, you can prepare the syringes. Your helper will need to hold the vials of saline and heparin for you, since the outside of the vial is not sterile. Attach the needles to the syringes by twisting them on. Now have your helper flip off the lid on the saline and heparin vials and use alcohol wipes to clean each of the rubber stoppers. Your helper then needs to hold each vial upside down for you. Next, remove the needle cap and pull the plunger on the syringe back. This draws air into the syringe. Now push the needle through the rubber stopper. Do not touch the vial. Push the plunger to force the air into the vial of saline. This will help the saline flow out of the vial easier. Turn the vial upside down and let the saline flow into the syringe. When the syringe contains 10 milliliters of saline, turn the vial right side up and take the needle out of the rubber stopper. If any air bubbles are in the syringe, carefully push the plunger forward to remove the air. Warning: air should never get into the catheter. Replace the needle cap very carefully and lay the syringe on the sterile field. Now prepare the heparin syringe in the same way. Your nurse will tell you the amount of heparin needed for your child's port. Be careful not to confuse which syringe is saline and which is heparin. Usually the saline syringe contains 10 milliliters of fluid, while the heparin syringe has a lesser amount. This can be your clue. Next, attach the cap to the end of the port tubing. If you are using a needleless system, take the needle off the saline syringe and screw the syringe into the cap. Flush the saline into the port tubing until you see drops coming out of the Huber needle. Now you know the tubing and needle are full of saline and not air. Leave the clamp on the tubing clamped.
You are halfway done.
Next, reach inside the sterile dressing kit and pick up the alcohol swab sticks. Use these to clean the skin around the port. Start right on top of the port and clean in circles, always moving outward from the port. Repeat this exactly the same way with each alcohol swab stick. There are 3 sticks in the kit. Next, clean the skin over the port with the chlorhexidine swab stick, starting on top of the port and moving in circles, just as you did with the alcohol. Let the skin dry for several minutes. Do not blow on it or wave your hand over it. This spreads germs. Allow the skin to dry itself. With your non-dominant hand, place your thumb and index finger on opposite sides of your child's port and firmly hold it down against the bony area of the chest. For example, if you are right-handed, use your left hand to hold the port. This keeps the port from sliding around as you put the Huber needle into it. Hold the Huber needle over the center of the port and push the needle down through the skin and into the port until you feel the needle hit the bottom. Confirm placement of the needle by drawing blood back through the tubing. Now, flush the saline into the port with a slow, steady push. The saline should flow easily. Next, take the small gauze from the dressing kit and fold it in half. Place it under the needle to make a cushion. This will keep the needle from rocking up and down. Now, take the cover dressing and place it over the top of the needle and port. Be sure the edges of the dressing stick tightly to the skin to keep out dirt and germs. If you are going to give IV fluids or medication, you should now take off the syringe and attach the IV tubing to the cap. Otherwise, you will flush in the heparin just as you did with saline. Then loop up the port tubing and tape it down for later use. Finally, throw away your supplies as directed by your nurse. Everything can be thrown in the trash except the needles. Your nurse will give you a special container for these.
Fantastic! Remember, the Huber needle must be changed once a week. Follow the steps for accessing the port with each needle change. Now, let's talk about flushing the port. Remember, the port is attached to a catheter, which is a hollow tube. The catheter lies inside a large vein, and blood flows around the catheter and can clot it. IV medications can also clog the port if it is not rinsed well before and after giving a medication. Flushing will help prevent this from happening. A sterile saltwater solution called saline and a medication called heparin are used to flush the port. The amount of saline and heparin used depends on the size port your child has. Your nurse will tell you the specific amounts to use for your child. The port should be flushed with saline between giving each medication. Also flush the port with saline and heparin when you have completed giving fluids and medications. Remember, if the port is not being used, it should be accessed and flushed once per month. Let's see how to prepare the saline and heparin syringes.
First, gather your supplies. You will need 2 10-milliliter syringes, 2 needles, a vial of saline, and a vial of heparin. You also need alcohol wipes and sterile gauze. Your home health agency will provide these supplies. Some home health agencies use syringes already filled with saline and heparin. Clean your workspace with alcohol from a bottle. Next, wash your hands thoroughly with soap and warm water. Remember to be careful not to touch anything other than the supplies. Open the syringe packages and lay them on the clean workspace. If the needles are not already attached to the syringes, do that now by twisting the needles onto the syringes. Be careful not to touch the tip of the syringe or the base of the needle. Now flip off the saline vial lid and use an alcohol wipe to clean the rubber stopper. Next, remove the needle cap and pull the plunger on the syringe back. This pulls air into the syringe. Now push the needle through the rubber stopper. Do not touch the vial. Push the plunger to force air into the vial of saline. This will help the saline flow out of the vial easier. Turn the vial upside down and let the saline flow into the syringe. When the syringe is full of saline, turn the vial right side up and take the needle out of the rubber stopper. If any air bubbles are in the syringe, carefully push the plunger forward to remove the air. Warning: air should never get into the catheter. Replace the needle cap very carefully. Now prepare the heparin syringe in the same way. Your nurse will tell you the amount of heparin needed for your child's port.
The steps for flushing the port are as follows.
If your child's Huber needle is not already in place, you will need to access the port for your monthly flush. For instructions on this, go back to the section on this tape titled Accessing the Port. Wash your hands thoroughly with soap and warm water. Remember to be careful not to touch anything other than the port and the supplies. Disconnect the IV tubing from the cap if necessary. If you are going to use your IV tubing later, place a protective cover on the end of the tubing. Scrub the catheter cap with an alcohol wipe for 5 to 10 seconds to remove germs. Once the cap is clean, hold it upright. Do not lay it down directly on your child's skin, since there are germs on the skin. If necessary, you may lay it inside a piece of sterile gauze. Take the saline syringe and attach it to the cap. Make sure the clamp is open on the port tubing. Push the saline in with a slow, steady motion. It should feel easy to flush. If at any time flushing is difficult, do not use force. Stop what you are doing and call your doctor immediately. If the port is clotted and you force the flush, you could cause a hole in the port tubing. Now remove the saline syringe from the cap. Then attach the heparin syringe and flush it in, just as you did with the saline. After you have finished, loop the port tubing up and tape it securely to the dressing. If at any time the flushing doesn't feel easy, this may be a sign of a problem. Check the following. When you are flushing, make sure the clamp on the port tubing is open. If it isn't, you won't be able to flush easily. Lay the port tubing out straight to prevent kinks or bends, which makes flushing harder. Finally, throw away your supplies as directed by your nurse. Everything can be thrown in the trash, except the needles. Your nurse will give you a special container for these.
Hi, I'm Ashley Tate. Next, let's talk about the port dressing. Whenever the port is accessed, it should always have a dressing covering it. This keeps the area around the port clean and keeps the needle from being accidentally pulled out. Once a new needle and dressing are used on the port, they can last up to 7 days, as long as the dressing stays sealed or occlusive. The dressing is usually clear, so the needle can be seen at all times. It's important to keep the dressing dry, so it will stay sealed. If the dressing begins to peel off, germs can get near the needle and through the skin. If the dressing becomes loose, wet, or dirty, change it immediately. Your home health nurse will help with dressing and needle changes. Look at the site every day where the needle is in the skin. Is it red, swollen, or do you see pus or drainage? If you do, call your doctor or nurse right away. These signs may be the beginnings of an infection, and your doctor may need to check it out. When your child's IV medication course or routine monthly flushing procedure is completed, the needle can be taken out. We call this deaccessing the port. The steps for taking the needle out are as follows.
Before you begin, wash your hands thoroughly with soap and warm water. Remember to be careful not to touch anything other than the port and the supplies. Unscrew the IV tubing from the cap. You will throw this tubing away later. Scrub the cap for 5 to 10 seconds with an alcohol wipe to remove germs. Once the cap is cleaned, do not lay it down directly on your child's skin, since there are germs on the skin. If necessary, you may lay it inside a piece of sterile gauze. Take the saline syringe and attach it to the cap. Make sure the clamp is open on the catheter. Push the saline in with a slow, steady motion. It should feel very easy to flush. Now take that syringe off. Next, attach the heparin syringe and flush it in, just as you did with the saline. You can leave the syringe attached for the next step. Loosen the dressing. Go slowly and keep your index finger on top of the needle. This will prevent it from being accidentally pulled out. Once the dressing is loose, put one hand firmly on the port. With your other hand, grasp the needle and pull it straight out. Hold gauze on the site for several minutes and then put a Band-Aid on it. Finally, throw away your supplies as directed by your nurse. Everything can be thrown in the trash except the needles. Your nurse will give you a special container for these.
Just as it's important for you to learn about how to care for your child's new catheter, it's also important that you learn about things that might cause problems. By following a set routine when you care for your child's catheter, you'll be able to spot any problem early on. Finding problems early will usually make solving them easier.
You learn to look for redness or anything like that around the site. They'll give you key things to be on the lookout for. Once you learn what to look for, then you know when to call the pediatric surgeon or the pediatric staff at the hospital and let them know if there's anything you're concerned about. And they're right there for you. I mean, if there's any question, anything in your mind at all that you're worried about, they will see you right then and there.
I can get in touch with somebody anytime I need to, and there's not a delay of, even 5 minutes to get a doctor on the phone. Nurses, at any given time, I can talk to a nurse about care, about anything. I did have one issue. I was accessing his line to flush it one day and it wouldn't flush, and within 2 minutes I had a doctor on the phone saying, everything's going to be okay, we can wait till tomorrow to worry about it, and that kind of thing. So it's been a great relationship as far as being able to talk to doctors and nurses.
It's just been great. It's like you feel very cared for. It's like a family that takes really good care of you. You feel very supported. I always know who to call. People are very accessible and are very warm and caring, and I just can't say enough good things about the relationship we've had with the people at the hospital.
Some problems might include infection, blockage of the catheter, catheter damage, or even dislodgement of the catheter.
A couple years ago, I was jumping on the bed with some twin friends of ours, and they came walking into the kitchen with his Broviac. He pulled it out another time when he was about 2, just by sliding down the front of me when I put him down. So I learned to reach out and put him down.
One of the things we've been concerned with was with him going to school. Older children, kind of like to push each other around and that kind of thing, and usually they push in the chest area when they are joking around, and so that's been one of our concerns, that somebody might get a hold of it when they touch his chest or something and pull it out. Baths have been an issue because you don't want to get that dressing wet, and so those have been things that we've been concerned with.
This portion of the video will focus on catheter-related infections. We will discuss how to prevent infections, how to recognize the signs and symptoms of an infection, and what to do if you suspect an infection has occurred. The best way to treat catheter-related infections is to prevent them. You and other responsible family members or caregivers are your child's best defense against complications. The family member or caregiver responsible for the catheter should protect it from persons unfamiliar with appropriate catheter care. Believe it or not, you may be able to teach less experienced caregivers or healthcare providers things about central venous catheters to help prevent infections. Learning which situations put your child at risk will help avoid potential infections. If a complication does occur, then early detection and prompt treatment can help minimize the problems. First, how can you prevent infection? Doctors and nurses will tell you not to allow germs or dirt to get inside the catheter. You might say, of course I won't let dirt get into the catheter. On the other hand, anyone who knows children knows that kids will be kids, and anything can happen, even in the cleanest household. There are germs everywhere. Germs live on the skin, in the air you breathe, and on the surfaces of every object in your home, including tables and countertops. Germs naturally live everywhere outside the body. The human body has natural protection, like intact skin, to keep the germs outside the bloodstream and vital organs. When germs do get inside the body, they begin multiplying and cause sickness. A bloodstream infection may be called bacteremia, or a catheter-related infection. We'll talk more about the treatment of the infection in a minute. Let's go back to prevention.
First, carefully follow all the steps for proper catheter care, including changing the dressing, flushing the catheter, and changing the cap.
Next, reduce the number of germs that get near the catheter.
Before bathing, bandages, tubing, and caps must be covered with a water-resistant material.
If the dressing accidentally gets wet during bathing or soiled while at play, the dressing must be changed immediately. Monitor your child's play, watching to see if the catheter is hanging loose or dangling. Keep the catheter taped and tucked under a layer of clothing to prevent pooling, movement, or unnecessary contact with germs.
When George first came out of the hospital, and for a year or so thereafter, his line was secured to his body just with adhesive tape. And I think that's what caused the breaks. Maybe it caught on something or something. And then I learned about MeFix, which is used in the hospital, or HypaFix, which is the brand we use at home, where his line is completely secured against his body. There's no part of it flopping in the wind except the very end where I access it. That may be the rule now on all kids, but if it isn't, I really recommend that the parents consider securing the line to the child completely with HypaFix or MeFix or some other mechanism.
Infection may occur no matter how careful you are with the catheter. Your child may be very susceptible to an infection because of his or her medical condition. This is especially true for children with cancer who are receiving chemotherapy. Always be on the lookout for signs and symptoms of infection. A fever greater than 101 degrees Fahrenheit and chills may be the first signs that germs are present in the bloodstream, a condition called bacteremia. Never ignore a fever of 101 degrees Fahrenheit or greater in a child with a catheter. The skin around the catheter may also become infected. Watch for red, raw, or angry-looking skin that may or may not be associated with drainage or pus around the catheter site. These signs must be reported to your doctor or home health nurse whether or not the child has a fever. Observe the skin around the catheter for swelling, blisters, unusual discoloration, or a red line that looks like a cord under the skin. Look at the dressing daily. Take notice of anything different from the day before. Listen to your child if he or she complains about soreness or itching around the catheter. Pain may be an early sign of a site infection. Early treatment is the key to a catheter-related infection. If you suspect an infection is starting or something doesn't look right, call your doctor or home health nurse. Don't wait, thinking it will get better by itself. No one can be too careful or overly concerned when it comes to a catheter-related infection. If you are unable to reach the doctor or home health nurse by phone, then go to the emergency room. Remember, the quicker an infection is detected, the quicker treatment with antibiotics can be started. In most cases, a blood sample will be taken from the catheter. Your child may receive a dose of antibiotics through the catheter. The doctor or nurse may remove the dressing and examine the skin around the catheter for redness, pain, or pus. Let the healthcare provider know the last time you changed the dressing and what the site looked like at that time. The doctor will decide if further antibiotics are needed and if it is necessary for your child to continue on antibiotics. This could mean that your child would need to be admitted to the hospital. If the infection persists after being thoroughly treated, the catheter may need to be removed and placed in a different site. Remember, the catheter is a hollow tube which fluids can flow through. Because this hollow tube is in a large vein, blood can be pulled back through it. If you are unable to push fluids through or draw blood back from the catheter, it might be blocked. This can be caused by blood clotting in the catheter or by the fluids that flow through the catheter clumping together. It can also be caused by something on the outside of the catheter, such as the clamp being closed. If you are flushing your child's catheter and it feels stuck, it's important not to use force. This can cause damage to the catheter or to your child. Instead, look closely at the catheter. Recheck the clamp. Is it open? Check the tubing. Is it kinked? If you ask these questions and you are still unable to easily flush your child's catheter, call your child's nurse or doctor. They will help you troubleshoot further.
The line is the major issue with George, and keeping him infection-free and out of the hospital. And I've had a lot of help with that.
Sometimes the catheter will flush easily. However, blood cannot be pulled out. This can be caused by a blood clot that acts like a flap over the inside tip of the catheter. This kind of blood clot can also grow inside the catheter. When you flush the catheter, this flap over the tip pushes open, allowing the fluids to go through. However, when you pull back to withdraw blood, the flap covers over the tip, closing the hollow opening and preventing blood from entering. Treatment for this type of occlusion is careful administration of a medicine into the catheter by your nurse or doctor to dissolve the blood clot. Most of the time, this will solve the problem. There are times that even medicine cannot fix these problems, and it will be necessary to replace your child's catheter. Air should not get into your child's catheter. Make sure that all tubes are tightly connected. If your child is very active, you may also want to place tape around these connections so that they stay together. Make sure that all IV tubing and syringes are filled with fluid or medication before connecting them to the catheter. If you follow these steps, it is rare for air to get into the catheter. However, you should be aware of signs and symptoms of air in the catheter. These may include trouble breathing, chest pain, or pale blue skin color. This is an emergency. If you suspect air has gotten into the catheter, clamp the catheter close to your child. Next, calmly lie your child down on his or her left side with the head lower than the feet. Call 911 to have your child taken to the nearest hospital by ambulance. Damage or even the accidental dislodgement of your child's catheter can occur if there's too much tension placed on the catheter. This may cause the catheter to break or even pull out. Damage can also happen if too much force is used to flush your child's catheter. It is important that you notify your child's doctor or nurse anytime you think your child's catheter has a leak. This is an emergency. If a leak occurs, you can help your child remain safe from germs by clamping the catheter next to your child's body. You can either use the clamp on the catheter tubing or use a smooth, toothless clamp. If you do not have a clamp available, fold the catheter and pinch it off with a rubber band. Then contact your child's doctor or nurse immediately. If during this time your child has any problems breathing or experiences chest pain, call 911, and calmly place your child onto his or her left side. Often, your doctor or nurse can repair damaged catheters without surgery. Remember to call your doctor or nurse as soon as you see any damage to the catheter.
Keep all sharp objects, including scissors, away from your child's catheter. Do not allow toddlers to chew on or play with the catheter's tubing. During any infusions, keep the IV pump close to the child to reduce tension on the tubing. Keep the catheter looped and taped to the child at all times. If your child's catheter is pulled out, apply gentle, steady pressure with sterile gauze to the exit site.
Then notify your nurse or doctor. The following information is a helpful list of do's, practices you'll want to follow, and don'ts, practices you should avoid.
Do's. Do use clean hands and sterile technique when performing catheter care. Do inspect your catheter site every day for redness, drainage, tenderness, or swelling. Do keep your catheter tubing looped and taped at all times. Do leave the catheter tubing unclamped except when changing the cap. Do use only smooth, toothless clamps on the catheter. Do keep the catheter connections taped with active children. Do regularly perform dressing changes and site care. Do keep your to-go catheter kit with you at all times. Don'ts. Don't use scissors or sharp utensils to remove the dressing. Don't use acetone, fingernail polish remover, or tincture of iodine on or near the catheter. They can dissolve the catheter material. Don't chew on, play tug of war, or jump rope with your catheter. Don't let your catheter get submerged underwater. Don't force catheter flushes.
We hope you have found this video to be helpful. You may want to watch it more than once and keep it handy in case you need to refresh your memory on how to follow any of the procedures.
It is important that you maintain good communication with your doctor, nurse practitioner, or nurse after you leave the hospital. Don't hesitate to call if you have any questions or concerns.
We wish you the best in providing care for your child.
By following the guidelines in this video, you will know how to safely care for your child's central venous catheter.